Kia ora everybody, and first of all I want to congratulate you all on managing to stay this long, and I know I'm holding you going back, so I'll try to be quick. But I just really appreciate the opportunity to come and talk to you about what we've been doing, and it's hopefully something that all of you could actually be involved with, because really wanting this to be a real sector collaboration with all the different groups that are involved in producing health informational resources and really trying to make some of the changes across the health sector that we've all been looking for. Okay, so what I'm going to talk about is the burning issue around where do you really find quality health information and resources, and the fact that they are all just scattered right across hundreds of organisations. So at the moment it's across literally hundreds of organisations. So I'm a GP, and in a week I could actually have to look up 100 websites if I actually took the time in a consult to find what I needed at that moment. So what's the reality? You don't. Because it's too impractical. You can't find that best article that you came across around for diabetes or for gout in that instant when you really need it. And I moved practices a while ago, and I arrived and I was just so frustrated where to find the best resources, because I thought it was so important for people to actually go away with something to help reinforce their learning. Because what percentage of information do people remember from what we say? Yeah, it's about 10 to 20%, and that's on a good day. So when they're unwell or stressed or suffering anxiety or depression, it's even less. So it's really important that we do find a more effective way of supporting people's learnings both before, during and after consultations. And that also goes for hospitals, so that when you're in hospital having appendectomy or any operation or gone in with abdominal pain, whatever it is, how often are you actually given really good information or apps or resources for you to go home and actually manage that effectively on your own? So some of the top things that get searched for on the internet, what do you think they might be? Guesses? Cancer, yeah, mental health as a biggie. One of the medications, one of the topics that we have downloaded the most is irritable bowel syndrome, because it's something you have to live with and you have to manage on a day-to-day basis, but it can have a huge impact on your life. So it's just one example of things that in medicine we don't have any great fixes for, but people really do have to manage it. So having good resources can really make a huge difference to the quality of their life. Okay. So there's no one main place to go to, whereas overseas most countries have got a large, big government-funded website that directs people to trusted information. So Australia, Canada, UK, etc. So where do people go? They go to Dr. Google. And obviously from a patient safety perspective, that's a real concern, because they end up finding really variable quality information. I'm sure you've all found it yourself, but all of you in the room is going to be that much more savvy than the average user in terms of knowing what is a good, reliable website. But for a lot of our users, they're not going to have that skill or that knowledge, so that's much more difficult for them to do. It's really intensive to maintain websites. If anyone's had any involvement, you've got to continually keep the information up to date. But as a country, we're doing that hundreds and hundreds of times around the country as we all keep reinventing the wheel. And the health literacy demands of the system have got so much more complex than even when I started in medicine, because the number of medications, the number of investigations, the number of things we can do has just quadrupled. It's just exponential increase. So for patients, it's so much more complex as well. When I first started 20-something years ago, when someone had diabetes, they would start diet and exercise, and very slowly you might add some medications. Now within a very short time you're on 3 or 4 medications, and if you have a heart attack you're not allowed out the door without a whole rattling case of medications as part of best practice. And people want quick answers. They don't want to read lots of information online. So when you're creating things, actually people read less than half of a written resource actually needs to be condensed right down when reading it online. So videos, we're really moving to try and identify videos about what is atrial fibrillation, what is anxiety, so that it's really quick and easy for people to find those nuggets of information. Now, one of the challenges for us has been finding that by New Zealand specialists or New Zealand nurses or health professionals has been really difficult, and finding New Zealand personal stories. So that's the area we really want to work on, and maybe it's something we can do together going forward in that space. And New Zealand's really multicultural, so we really do need resources in multiple languages. And just using Translate on Google or something like that is not reliable. You don't know what the word's going to be translated as. So it's really important to be able to access those information in different languages. So our current approach is really inefficient, suboptimal and wasteful, and across the country we're spending millions and millions of dollars unnecessarily because we're not doing it in a more coordinated way. But the challenge we've had, of course, is that building a business case to really demonstrate this to DHBs and to stakeholders is really difficult, because all those resources get developed by different services. So within the Auckland region there were 3 different DHB teams developing warfarin charts. And developing patient information around warfarin, and I'm sure you've all got equally numerous examples of that. So if we can find a way to try and share that information, like Hilary talked about, when someone's created something great, share it with someone else. It's all taxpayers' dollars. We've really got to find better ways to be more efficient. So these are just a quick flick through some of the different sources. You could all name a lot more. But obviously there's DHBs, there's lots of Crown entities produce lots of information, there's publishers, there's PHOs, there's professional organisations. So one of the best resources I found for eye conditions was on the Optometry New Zealand website, but I wouldn't have naturally thought to go there. So it's just one example where if we work with those professional groups, we can hopefully bring those resources to a much wider audience. Academic groups, universities, research teams develop lots of fantastic resources, but again they're pretty hard to find if you don't know about them. NGOs provide some of the best resources across the country. So obviously Diabetes New Zealand and Joe's here, Heart Foundation, Mental Health Foundation, Asthma Foundations, they all produce fantastic resources, but knowing how to pull that together into one place would be really useful. Health Navigator New Zealand, so we started 5 years ago focusing around long-term conditions, so diabetes, heart disease, arthritis, things like that, because we've just found that was such a paucity of information for people to manage well at home, and we really wanted to support that. We've now moved to providing all conditions because we've merged with the Everybody website. People know that? Quite a lot of people know it. So it's owned by MIMS, which is an international corporation. They're no longer wanting to do online health information. So fortunately they've gifted the content to us, which is fantastic. So the medication information will carry on as part of their arm, but the other side, so the Everybody website and the Live to 100 is we're merging at the moment. So our writers are busy trying to simplify the content and make it a standard format as we move to building a new website. Lots of commercial groups as well, and actually some of the best resources are from drug companies. We've had a policy of not linking to anything from drug companies and wanting to be completely independent, but they do have the money, and so often people show us these great resources and we go, oh, it's great, but... and so that's something we're really wanting the sector to help us decide. Is that really important going forward, or do we have some clear criteria, and if it's judged to be unbiased and valid and current, then is it okay to use those things? So that's what we want, much wider input from yourselves. And when we have done a survey, consumers were less concerned about that than health professionals were. So that was also an interesting difference to identify. And then there's Health Directory, so HealthPoint and other groups provide a huge amount of information around services. Clinical pathways, who's involved in pathways around the country? Yep, quite a few. So again, groups are developing lots of great resources through that, and it would be great if we can share that where it's been developed, and the patient information. So I've been involved in some pathway groups, but the patient information is a side that often is not actually really prioritised, and that's self-help for how do patients manage at 3 o'clock in the morning? When there is, you can't just pick up the phone and ring your GP. So how do we really support them with that? The wellness industry is $1 billion industry. There's lots of stuff out there, obviously. GP teams develop their own resources because often they don't quite know where else to go. And of course, there's lots of individuals. There's all sorts of specialists who developed websites. One of the Gastro Info is a gastroenterology website that has lots of good information. So lots of examples of those around the country as well. Okay, so we've been doing a lot of research trying to find out, well, what's happening around the world, and particularly in Australasia. So this is a one from Australia that was done in 2013 by a group called Flaxworks. And they said to people, this was about 1,200 people were surveyed, and they said, what did you do last time you had a non-urgent health need? And there you go, 40% went online first. And so as a health system, what are we doing to actually really ensure that when they do go online, they're going to the right place and getting the right information? So 27% went to a chemist, 34% went to the doctor, 28% talked to a friend or family member, 19% did nothing, 5% used a healthline, and 35% went to hospital. So it's just interesting to see what do people do. Now obviously that adds up to more than 100%, so some people did, for those that are still awake and doing their maths, but obviously some people did both. But it's just interesting to see how many are going online first.
Janine, can I just ask, do you know the age range of those people?
Not for the detail of that. In our survey we have got the breakdown, and in this one the younger age group of course go online a lot more, but over 50-year-olds still are going online quite a lot. Yeah, they're not going online with mobile the same as the younger population, but they are going online a lot, yeah. Actually that study's got the number of hours people spend online as well. It's really quite daunting. Think how many people have that much time in the day? Okay, so we did a survey just to try and start finding out about New Zealand, what are we doing? And we really wanted to target high needs populations. So we were at the Atamira, which is a Maori festival in Auckland in September, and we surveyed a lot of participants, and we had some Maori students do it for us so that it was really low key and acceptable to the people there. And we found out that, you'll see the figures there, so over 64% of the population were going online at least monthly to look for health information. So that's really quite a huge percentage, and over the year it was over 90%. So a quick show in the room, how many people have gone online in the last year to look for information? So now you're an informed audience, but this is just showing that this was particularly Maori Pacific and an Indian population, they were also going online. Okay, so our vision is that all New Zealanders can easily access the right information at the right time and place to enable them to make informed and appropriate healthcare decisions and choices. And it's really important that it's making those right decisions and choices. It's not just about giving health information. Just giving health information doesn't change behaviour. So it's going the next step to really give people the apps, the tools, the resources to help them actually make those decisions that are right for them. So what we've been doing is forming an eHealth Alliance. So what we found is, as a small charitable trust, it was a good place to be because we were independent of one DHB or one PHO, because otherwise you get branded and other people are less happy to work with you. Unfortunately, we're still a little bit like that in New Zealand. But what we're doing now is forming a eHealth Alliance. So we're really wanting to say, let's do it together. The content will then be available to the partner organisations to reuse through DHB websites, patient portals, etc. And then it will also improve the consistency of messages that are given. So we're not wanting to take over other people's websites. There's still a really important role for that. What we're wanting to do is join the dots. Provide that summary information and then link to detailed information on Heart Foundation, Diabetes New Zealand, Ministry of Health websites, etc. So Immunisation Advisory Centre, Poison Centre, etc. So all that detailed information would still sit with them, but we're just a front door. So it's one place you go that you can recommend to people and know that they're going to get headed in the right direction. And we're really wanting to look at, as I said, supporting that learning at different stages of the journey. So before consultations, after and during. And in the States, I saw some videos of just the amazing technology that they've got of how they can just they email these resources to patients really easily, which of course we're going to be able to do more and more with portals. They have the videos come up during the consult. They can sit with the healthcare assistant or nurse before or during or after the consult, and they've really just got whole complete packages. So we're wanting to start doing that to some extent in New Zealand with New Zealand relevant content. Okay, so what do people look for? That's, of course, one of the next big questions is, well, if we're going to do this, what do we focus on? And what you can see here, it's a busy slide, I'm sorry, but it just shows you that they look for a wide range of things. So health conditions is the top at 13%, but information about symptoms is also really high. So people Google what to do about their diarrhea or fever in a child or constipation. They also are looking up diagnoses. So if they've been diagnosed with something, it's one of the first things they do when they go home is find out what does that really mean. The tests and operations in some other surveys, that's actually much higher percentage, particularly in the States where they probably have a lot more procedures at focus as well. Prevention is also really high. Don't forget, this is our survey with our Maori and Pacific population who were actually looking for prevention information. So that was really encouraging to see. Also, that information about diet, nutrition, smoking and alcohol was also at that similar level. Support groups was a bit lower than I thought it would be. Finding a service was 9%, and then scientific articles or research. Now we've separated out the healthcare providers now, but a few of them slipped in here because I don't think that many people are actually looking up the research, but some are. So we're really wanting to try and match the information needs with where people are at on their journey. And actually this is just a slide, because I usually talk a lot about long-term conditions, just highlighting the fact that it's such a big area, but a lot of the care is actually what people do themselves at home. For themselves and with their family, and it's only when people are really at that complex end, so that's people like on dialysis or going through oncology where it's very medical and it's very complex, but a lot of the time is what they're doing at home. So we really need to be doing everything we can to support them with that. And if you think of the ministry priorities, CVD and diabetes are two examples where it's very much what people do at home that makes the difference once they've had their initial treatment or stent or a bypass if that's been required.
What's CDM?
Chronic disease management. So this is people who have a long-term condition, so anything from arthritis, diabetes, heart disease, etc. So the well population or at-risk population sit here, and then the well population sit down below that. Okay, so also just wanted to highlight the fact about the different life stages, so that it's right through from pregnancy, and actually that's one of the biggest searches is pregnancy information. And of course they're a young population, they're very mobile, and they're tracking their fertility, they're tracking their expected date of delivery, everything right through on their phones. Children, youth, adults, older people and end of life. So it's really relevant at each of those stages. Now in the States, they've also done a lot of work around information therapy. Has anyone heard of that term before? Information therapy. No? Okay, so they've really taken that to the next level of saying that the right information at the right time can be as effective as medication in a lot of instances. And so ponder on that, have a think. Do you agree with that or not? But there are some great white papers out there that really give you a lot more detail to that. And I'd love to see us really look at some of the really effective information therapy tools that are available overseas, and whether we could nationally license those as a collective group and make them available to our populations. So, as I've said, we're really just wanting to join the dots with all these sorts of organisations, and it has felt a bit like herding cats. We've been talking for about 18 months about doing this. We're now finally getting it off the ground. And there is a real groundswell. There is now, most people are actually starting to say, yep, actually this totally makes sense, it really is the right thing to do, and starting to really get behind us with that, which has been great, but there's a long way to go. So the challenges is that everyone is well down the track developing their own resources, and you do get quite a lot of branding and IP concerns, even by government funded organisations. And there is that balance between commercial and public good that we have to really walk that fine line between. And it can be challenging working together, but it's also incredibly rewarding. So we're really wanting to look at those synergies. But the longer we leave it, the harder it's going to be. Imagine ever having to try and file that pile. Okay, so where have we got to? So we've had a couple of meetings around the eHealth Alliance and had people from in the room here at those and from across the country. We're now drafting the business case, and that's getting rewritten as we really try to hone down on what's the key areas we can try and address. The website is getting rebuilt, so it's going to be on a new platform and include a lot more Web 3.0 functionality. And we've got a little team of writers around the country really trying to continually simplify the content and make it really accessible to our multicultural population. There's a real continual quality improvement process, and then hopefully we'll get to the stage where the Alliance is really working well, and we do actually identify those best resources and purchase national licences. Whereas at the moment there are individual DHBs purchasing licences for different content. Whereas if it's really good, let's do it for everybody. Do people agree that's a way to go? Yeah. So the points of difference is that we're really wanting it to be trusted, consistent messages, New Zealand focused. We're really trying to put a health literacy lens over everything that we do. Now that's actually really hard work because all the resources are actually often written at a reading age of 12 or more, and we need to be targeting much more at a much easier level, and people want quick, really concise, easy to read information. So a lot of the content we're getting from the Everybody website, we're just having to cull and just write it. I was reading something last night and I just thought, gosh, an ophthalmologist wrote this. And it's just such a different way of writing that we really have to rewrite everything. So it's a big job. We're also really wanting to support behaviour change and the shared decision making. So there's quite a lot of tools out there to support that, and I'll show you a couple of those. So I'm just going to quickly show you the website. Has many people seen it? Yep, a few people have. Great. So it looks a bit sad and old, but we're working on it, and the new website will look completely different. So just to give you a really quick idea of some of the pages, so here's one on anxiety. So where we can, we try to have videos. So the NHS have got some fantastic videos. Ideally we'll replace these with New Zealand ones in the future where we can. So we try to identify just a few key points. Now you'll be amazed how hard that is to do. We had a gout group trying to ask them what's the top 5 messages we should consistently give across the country, and we debated the 5 messages just for gout. So the reality is we can't do that for every topic. Just like clinical pathways can take months and months and months to get agreement. So what we're doing is we have reference groups that help give us some oversight into the different topics. As we've got much broader, we can't have reference groups for everything, it's getting too big, but we are now moving to having topic editors and peer reviewers, and then we'll pass them around to different people that just help us keep it up to date. And obviously by working with the main professional bodies and NGOs, we're hoping that will keep it at a pretty high level. But you'll see there, if I just scroll down a bit, we're trying to identify fact sheets and videos, so that's there for people to go and have a look at. Where there are great resources such as the journal, making sure they're really available. When I talk to GP groups, it's still amazing how many don't know about these really amazing programs that are available free. So just in every way we can, we're trying to promote those. Anxiety apps, there's amazing apps out there, and the reality is most of us don't end up recommending them because as an individual clinician we can't review every app out there to know which one is actually reliable and appropriate. I was preparing for this, I was going through looking at the reviews of medical apps, and of course there are thousands and thousands, and very few have actually got evidence behind them. But there are some groups doing it. So the NHS have got an app library. There's obviously ones that have had RCTs behind them, and actually I was on the Black Dog website last night, so it was great to see that there. So they have actually got some really good apps. So I've actually contacted them saying, can we use them in New Zealand? But apparently it's probably going to be a license. So, and then where we can, we're linking to clinical pathways. So whether you're a consumer, a family member, or a health professional, when you come in here, you can hopefully find what you want really quickly. so that you can just click on this and go through to a clinical pathway. Now that's a challenge because every area has got different clinical pathways. So we've linked to the ones that are publicly available, and where there isn't one, we've linked to the National Institute of Clinical Excellence in the UK or other areas that we've been able to find. But so at the moment, that's one of the NICE guidelines from the UK. We're then trying to develop a bit of approach where this is one of the few we've done it like this, is thinking about if you're newly diagnosed with anxiety, what are the key things you need to know or learn about? So we're just trying to sort of provide people with steps along the way, so assessing your symptoms. One of the other things that I find really hard in the practice is knowing good assessment tools, because again, I'm not going to know which is the best one to use for anxiety or for every other condition. And this was really brought home to me one time when I had a patient and I thought, gosh, I wonder if she could have bipolar disorder. And I thought, I knew I had one in my drawer, but the reality was I had no way of finding that tool at that moment in a consult when I needed it. And I also really challenged myself because I thought, how do I actually know that that is the right tool to use and it's not going to do more harm than good to use it? So that's why we want groups around the country to help us identify the best ones and make them available. Now, this is the generalised anxiety disorder questionnaire, so I was pretty happy to put this one on here. And the great thing about this is that it's actually available in multiple languages. So by going here, you'll find it, whereas the ones we pull out of our drawers are very faded because they've been photocopied so many times, and they're not in different languages. We've also developed a few resources along the way. So this is one that we developed for depression and anxiety, and it's just an action plan that just helps people think about eating well, getting enough sleep, managing stress, all those typical things, but giving them something to take home with them. Because of course we give so much information when someone's depressed and they're going to remember even less of it. So this was one of our things that evolved years and years ago when I had young children, and I ended up with lots of depressed patients because I was part-time and female, and that's one of the things that sort of evolved out of that era in my career. Different treatments, clinical pathways as we talked about, and then we go for more, learn more. So some of the other ones, dementia, so again there's videos, a little brief overview, symptoms, patient resources, again really trying to focus on videos. People really want to hear other people's stories of living well with dementia or with as a carer, how to care for yourself, etc. Brief information about treatments, and then resources for clinicians, etc. So it just goes on. So that's what the health topics tend to look like. One of the things that got us started right back in the beginning was easy to understand medication information. Has anyone struggled to find this? Yeah. So back when I was a younger GP and seeing lots of depressed patients, this is actually one of the things that got me started on this journey over 10 years ago, was the fact that finding easy information around antidepressants was incredibly difficult. I started ringing people and saying, who does it? And they all go, it's not our job. No one saw it as their job. And so they said, go to the MedSafe data sheets. But how long is it? Do you know how long those data sheets are? They're 10 to 15 pages long. And if you read the data sheet for paracetamol, you wouldn't want to take it. So it doesn't put it into context, and that it doesn't really help you understand that these side effects are rare, and rare means less than 1 in 100 or 1 in 1,000 people actually experience that. Just has these long lists of really terrible sounding things, such as thrombocytopenia, which isn't so great, and a lot of people were not taking their medication because they weren't really understanding it. So we were hoping this was going to happen nationally, but it hasn't really yet. So we've developed a short list. We've probably got about 30 or 40 medications we've done so far. And actually we had some pharmacist students, they were over from Sydney. They helped us really get this started, then our medication group reviewed it. And Susan Reid was on the group with us, and she was fantastic because she challenged the pharmacists in the room to really use plain language. And so that we do have to talk about poos and use the things that people are going to understand rather than use medical jargon. Or when we do, make sure we explain it in a way that people are going to understand. So there's just really simple information about it, and then it links to more detail for prescribers down the bottom. Okay, and then for clinicians, there's an area that we called Centre for Clinical Excellence. And what we're hoping with the new site is that all of this information will be available through the patient portals. And so it may well be that for portals we'll decide to take health topics if that's what's decided, and the medication information. So that's part of the process going forward. So in this area there's all sorts of information about continuing professional development, and we get all sorts of inquiries through the website about this. People actually really appreciate finding it in one place, because at the moment you do have to go hunting for it. Health literacy, so we've got the 3 steps pamphlet there. And I was doing a workshop last week, and this was great. So when there are excellent resources like this, we're really just wanting to make them much more widely available. We've also got a section around information in different languages. So in this one here, again, we had a social worker from India. She did some volunteer work with the Refugee Collaborative and worked with us on this because she was looking for work experience in New Zealand. And it was great because she understood all the Arabic and all the Hindi pages and could help us identify the best ones. And then we ended up with quite a few different students from different backgrounds helping us, which was great. So there's been lots of different volunteers. But if you have a look at the Samoan one, like one of the things we found is that for diabetes, for instance, there's a great booklet on starting patients on insulin, developed by Waitemata DHB, and it's available in 5 different languages. So that's a huge bonus if you know about it, but if you don't know about it, then it doesn't get used. So that's some of the sort of information that we're linking to on this page here. So yeah, and then within each topic we're starting to have a section around different languages. Okay, so any questions about the website at this point? Yeah.
So it'll have to be updated all the time.
Yeah.
So how will we know that, well, how often, I mean, what's the plan for that? Because, when you go to Google, you'll see, the date when it was.
Yeah. So on the bottom, at the moment we've got 2 types of health topic pages as we're moving to the new ones. So all the new ones have the date it was last updated on the bottom. Yeah. And we're now also putting the credits of who helped create the pages or review them, etc. So that's all starting to be a lot more explicit and transparent.
And are you doing recovery time for conditions?
You mean how long it takes? We give general advice, but of course we don't want to get into risking giving advice that people could be confused by. So we generally will say, in general, chickenpox will heal over 7 days, etc. Is that what you mean?
I've used a medical disability guideline thing at various times, and it's got it'll say, heart attack or something, and what's the likely recovery period?
We haven't done that for all of them, but if that's something people really want, we can look into doing that. Yeah. And we have an administrator whose job is to go through and make sure everything's getting updated and sending it out to all the different people for review. So it's her full-time job. There was another question somewhere down the back. Sorry, was that about the resourcing, the funding? Sorry, the funding or the resource?
It's just about, I would imagine that the ongoing updating of the website will be enormous.
It is.
And how you'll fund it?
Yeah. So as part of the eHealth Alliance, we're looking at developing a membership model so that different DHBs, PHOs, different organisations can come on as a partner organisation. If they come on as a partner organisation, then they will also have access to all the content to reuse through their own websites. And then there's different levels of membership that organisations can join. We're also looking at whether there'll be a corporate sponsorship category and how we can come up with a public-private partnership that people are going to find acceptable to do that. Yeah, but it's a huge challenge for us, which is why we're moving to the eHealth Alliance model. Yeah. Okay, thank you. I've just got a few more slides, so you're doing really well. Okay, so one of the other things we're looking to create is a video library. And in that video library, we're wanting to have two main areas. One is for consumers, as we've talked about, but also their personal stories of living well with different conditions or overcoming adversity. And we've had some fantastic presentations today, and I was thinking, we'd love to have those people on video on the website. And also videos for health professionals. It's amazing the lectures that you can find online from some of the best universities in the world or best lecturers free. And so what we're trying to do is when people come across something great, tell us, and then we'll make it available to everybody else. So that's another great resource that really will benefit everyone as we build that up going forward. Oh, that's just some diabetes resources. This was a self-help guidebook developed by the University of Manchester. So this is one of the ones that we get quite a lot of hits for because it's just takes people through step by step how they can look after irritable bowel and manage that well themselves. There's lots of different action plans that people can use. Probably mostly health providers use that page. And then, of course, I've talked about the journal already. And then that's one of the Heart Foundation modules that we promote through the Centre for Clinical Excellence. And there's fantastic cultural competency training as well. So I was going to highlight this one because not everyone will probably be aware of the CALL training. This is culturally and linguistically diverse training, particularly for migrant and refugee populations. So this was developed by Waitemata DHB, so some of the South Island DHBs might not be aware of it, but fantastic online modules that you can do yourself in your own time and get certificates for, etc. So that's worth having a look at. So it's calledresources.org.nz. You do have to sign up for it, but it's worth having a look at. Okay, I'm just going to flick through these because it's time to go. But it was just one of the next phases we'd like to look at once we get the website rebuilt and working really well is the whole patient forums and the patients like me. People seen that? Yep. Actually, hands up who has seen it. Only a few. So this is one of those amazing online communities that's developed in the States, which is worth being aware of. They now have thousands of conditions, and what they found is that people are willing to share really personal information and track their progress online because of the research and the care that's come out of that. So a bit like we heard this morning about the interleukin-2, people have found out about treatments through the Patients Like Me website. So it was started by two brothers, and the other brother had a really rare disorder. And what they found is that by sharing their information, they were able to find that a neurologist in some other country or whatever had trialled something that was actually working. And so they were able to share that information through that website. So there's a huge amount of research actually developing out of that website as well. So decision aids, have people seen these? Some people have. So there's quite a lot of different decision aids around the world. Option Grids is from the UK. This one still needs a bit of a translation from a health literacy perspective, in my opinion. But it's also focused particularly on elective surgery, so tonsillectomy and knee surgery, etc. This one's around high cholesterol. But they are a tool out there that they're freely available and can be useful for certain populations. NHS Direct has also, with the BMJ, have developed a whole lot of different decision aids around particularly elective surgery again. So what are the pros and cons of having knee surgery or shoulder surgery? And this is a really real problem because I'm also a GP liaison, and one of our orthopaedic GP liaison has found a lot of people get referred to orthopaedics for outpatient appointments, not aware that basically that equates to assessing whether they're going to have surgery for their hip or knee joint. They didn't realise. They said, I never would have wanted surgery. And so what needs to happen is those conversations need to happen sooner. So people actually know the pros and cons, have thought about it, and then can make a more informed decision or choice about whether they would even want to contemplate surgery. Of course, that would be beneficial for DHBs in that there would be less people turning up unnecessarily when it was the last thing that they would consider doing. This is one of the, they call them information therapy conversations. Now these are fantastic. I think they're really amazing. Unfortunately, this one's, I can't find it on the web anymore. It was available for a time and now it's licensed, and so you can't easily access it. But this is one that for back pain, if everyone who has back pain knew to go and do this first, a lot of people would not need to end up actually coming to see us. for the first few weeks, because it takes them through how long have you had the back pain, it checks out all the red flags, it then gives them the really nice graphics around how your back's not a crane and how to lift and how to take simple painkillers and things to do and not to lie in bed in a really easily accessible manner for everybody. And it's just such a great example. They've also got ones for diabetes and other things. So these are some of the things I think I'd love a group of us to review and assess and look at licensing. Now, apps. How many of you have seen these apps? These are all actually, all of them are New Zealand apps. So again, this is where we, as a wider group, we can review them. So Food Switch, most people have heard of that one, hopefully. It helps you. It was done by University of Auckland and BIPA, and you can helps you make healthier food swaps. Healthline with the Ministry of Health have developed a symptom checker. Now, overseas, symptom checkers are hugely popular. So it links to helping people make good choices about when to access further support. Phobic Trust have done one for anxiety, and over here St John's New Zealand have done one around CPR, so that for people can have it on their phone if they're ever in an emergency, they've got it there, it can remind them. And I haven't actually got it on my phone yet, but I think someone said it actually makes the beep, so you know you can time yourself to do your CPR. So this is where, I mean, this is just the way technology is going, and it's about how do we make the most of that so we really can support people with that. Does anyone have any of those on their phone? Yep, cool, one person. Cool. Okay, and then as Hilary was talking about, there's actually a huge amount of great resources that can support people towards the end of life, both for the family as well, and at the moment it's quite variable, the information. They often get quite overwhelmed. So that's some of the things we're going to be focusing on. In terms of portals, at the moment most vendors have got very little patient information tied to the portals. They might have a few links, but it's actually very, very minimal. And I've spoken to a few people from different portals about that. So what we would love to say is, well, look, if we're doing this, why don't we use this content, all contribute, make it as high quality as we can, while keeping it doable, because overseas they have like 100 writers in their teams. They just have these huge teams for things like UpToDate. But the reality with UpToDate and WebMD and those other really big ones is it's so much content, I can't actually use it in a consult because I haven't actually got time to read all that information with a patient in front of me. So we're trying to keep it really short, simple, bites of information that you can use, and hopefully stuff you can really share with your patients as well. So that's just to quickly highlight some of the governance. So we're forming the Alliance Steering Group. We've got different advisory and editorial groups and our reference groups. And then Health Navigator has a separate trust board. And so there's lots of people across the country involved. But we'd really love to have all of you involved as well. So if anyone's thinking, oh yeah, that sounds like a good idea, please get hold of us. We're really keen to have more people on board with this and really wanting to make sure that we're partnering with consumers at every level to make sure we get this right, that it's actually really going to work for all different New Zealanders. So we're going to have approved content providers, as I sort of mentioned, and the next steps. So we're really at that point of rebuilding the site and forming the eHealth Alliance and getting the business model sorted, because it's just such a big challenge. So thank you all very much. I've got a few of the wallet cards over there. Please take them, share them around, and just let us know through the website if you want any more of those. So thanks very much for your time.